So we reviewed several U.S. survey data for, it represented the U.S. population. And we decided on the National Health Interview Survey that's conducted annually by the CDC's National Center for Health Statistics. And it captures information on individuals' health status for adults age 18 and over. Mental health had a significant impact on mortality. If you looked at the mortality for, let's say, starting out at the younger ages, age 45, the individuals who had mental health, their mortality was 2 to 4 times higher than those individuals that indicated they had no mental health conditions. And then as the ages increase, the gap narrowed. So there wasn't a lot of difference at the high ages like age 80. The difference in mortality varies greatly between the number of chronic diseases that an individual has. And I think you can see it more clearly by looking at just the differences in life expectancy. So if an individual doesn't have any chronic disease, they're at age 45, the life expectancy of these respondents was 40 years. Then if you add a chronic disease, the life expectancy then reduced to 35. With 2 chronic diseases, the life expectancy now is at 31. And then for 3+, the life expectancy is all the way down to just an additional 22 years. So if an individual, and again, this is based on the survey data, if an individual had COVID-19, the prevalence of mental conditions and chronic disease, which was much higher than those individuals who had never had COVID-19. The report showed that the prevalence of unhealthy is much higher for Black or African American individuals than white individuals. The report also looked at 4 different regions, the South, Northeast, Midwest, and West. And what the analysis showed was that the South also had a higher proportion of unhealthy individuals than the other regions. So the top 5 causes of death in the NHIS data, the number 1 was cardiovascular disease, number 2 is cancer, and those 2 alone they represented 50% of the deaths in the data. And then that was followed by respiratory disease, cerebrovascular disease, and then accidents. So all those 5 ended up being like 65% of the total deaths in the NHIS data.